You are listening to Wellness Prescribed with Fisher-Titus Medical Center. And here with me now, I have OBGYN Dr. Mona here for Wellness Prescribed with Fisher-Titus Medical Center. How are you today, Dr. Mona?
Good. I'm doing well.
And you serve different areas with your practice. So where's your office located?
Right now, my office is located on the Fisher-Titus Hospital campus on Benedict Avenue.
Okay, so with an OBGYN, you serve a lot of different people, and what sort of care then goes along with an OBGYN for people that might not be quite sure what services you provide?
Okay, so as an OBGYN, I care mostly, well, actually all women, pretty wide range of ages, so adolescents to pretty much 80, 90 years old.
Okay, so you kind of do it all then with
Yes.
any sort of women's
health.
Okay.
Yes.
So when we are talking, though, OB, part of this, so prenatal care comes into play with that. So can you talk to us about prenatal care that you might provide for people?
Okay. So I do care for women pre-conception and then during pregnancy and also postpartum. So the biggest thing about prenatal care, of course, trying to get your care established early in the pregnancy. That way you know you're ensuring healthy pregnancy and a healthy baby.
So how early then should an expectant mother start that prenatal care?
I usually advise all my patients once they find out they're pregnant to contact the office. And then that way they can establish care with the OB nurse initially. And then usually we see them in the office for dating ultrasound and then also first visit with me around 10 weeks or 11 weeks.
Okay, so what all is involved with the prenatal care then?
So prenatal care, we basically, make sure that they're not anemic, so check their blood level. That's kind of like the basic blood work that we do in the beginning of pregnancy. And then we monitor how the mom is doing early in the pregnancy, throughout the pregnancy. We also do anatomy ultrasound to assess the structure, anatomy of the baby, and kind of give them kind of general guidelines of what to expect during pregnancy, labor, postpartum, and everything that comes with a pregnancy.
Okay, so Dr. Mona here, OBGYN with us speaking now. What then is postpartum care? And what types of postpartum services are offered to mothers in the area?
So postpartum care is pretty much, after delivery, directly after delivery, up to 6 weeks or 8 weeks after you deliver. We give them support for breastfeeding if they need any breastfeeding support or any issue with probably like general mental health after delivery. Okay, so postpartum depression, which is needs to be addressed early on, and also just a general recovery, postpartum recovery.
So what then, talking about that, what sort of resources and support networks are in the area for new parents or pregnant individuals, and where might they be able to access those?
Well, one resource probably you can contact the hospital, you can talk to somebody in labor and delivery, and also contact our office, the OBGYN office. That's probably a good place to start, and then we can guide them where to get the further, resources.
Okay, so what kind of advice then would you give to expectant parents who are preparing for labor and delivery?
So I usually advise my patient to educate themselves, whether, learn it from support group online or website. I usually give them a suggestion to check ACOG website, which is American College OBGYN, or contact the labor and delivery. They have resources for expectant mother or pregnant mother or the office. So
Okay, so beyond the scope then of pre and postnatal care, what sort of everyday health concerns can patients discuss with their OB/GYN?
So in adolescents, of course, if they have any menstrual issue, then I can address that with them, or just a general contraceptive advice. We can discuss that too, and general health, concern too. If they planning to conceive, then usually, we want to make sure that they could be as healthy as they can, prior to pregnancy. That way, reducing risk during pregnancy, also delivery.
All right. So then if people want to learn more about the services at Fisher-Titus and in the surrounding area, where can they get that information?
You can probably go to Fisher-Titus Hospital website.
Okay. Fisher-Titus.org.
Yes, that's
Okay.
correct.
And that is where you recommend they go to get that information.
Yes.
Okay. So again, Dr. Mona, I'm sure people can contact you as well to make those appointments and
Yes.
to see somebody and talk to an OBGYN to get more information about this. And again, Fisher-Titus.org is the website to go to for that.
That's correct.
And thank you so much for taking the time to talk with us today.
All right. Thank you very much for having me.
You've been listening to Wellness Prescribed with Fisher-Titus Medical Center.